Hi, everyone. As Louise mentioned, my name is Anila Jacob. I work for DAI, which is an international development company headquartered in the Washington, D.C. area. DAI is a primary implementing partner for a USAID project known as Integrated Natural Resource Management, INRM, and I'm the Food Security and Global Health Liaison for the project. As Louise mentioned, I'm also an internal medicine physician by training. I have been working with USAID for over a decade, first within the agency as a AAAS fellow. And then for the last 9 years, I've been on the implementing partner side. I wanted to start by thanking Taylor and the GUND for this opportunity to present at the GUND Exchange. I've had the pleasure of working with the GUND on a research activity looking at the linkages between the natural environment and human well-being, which I'll explain in more detail later in the presentation. So this is an overview of what I'm going to talk about. I'll start with a brief introduction of USAID and then discuss some specific activities. So when I use the word activity, it's equivalent to project. Activity is a word that USAID uses. And you'll notice that there are a lot of acronyms with our activities. USAID loves its acronyms. And of the ones I've listed, I have worked on Bridge and I currently work on INRM. So I think, as most people know, USAID is a donor agency. The vast majority of its activities, the vast majority of the activities that it funds are implemented by partners. So, for example, the prime implementing partner for the Bridge activity was DAI, who's also the prime implementer for the INRM activity. Most USAID activities last from 3 to 5 years, and then towards the end of an activity, if the agency wants to continue work in that particular area, whether it's a technical area or geographic, a new request for proposals will go out. So in that way, the agency is able to work in the same region for many years under new activities. So let me continue to talk about USAID a little bit. It's the agency that leads the US government's international development and humanitarian efforts. Budget in fiscal year 2020 was about 19 billion. The stated priorities of the agency are to promote global health, support global stability, provide humanitarian assistance, catalyze innovation and partnership, and empower women and girls. Some major initiatives that you might have heard of include the President's Emergency Plan for AIDS Relief, known as PEPFAR, the President's Malaria Initiative, known as the PMI, and then Feed the Future, which is the big food security initiative of the agency. So as an example, PEPFAR was started under the second Bush administration, when HIV rates in some countries, particularly in sub-Saharan Africa, were very high. And PEPFAR has been very successful in getting antiretrovirals to people in low-income countries. So how's the agency set up? We have field offices and we have our headquarters in Washington, D.C. So our field offices, which we call missions, are present in over 100 countries, and they program the majority of USAID funds, as you can imagine. The Washington, D.C. offices provide technical assistance to missions for design and implementation of programs. They determine the funding level for field offices, and they establish agency guidance on different processes that the missions will then go on and implement. So this is the current structure of the agency. The structure actually changes periodically depending on the administration. For example, when I started as a AAAS fellow in 2010, I was placed in the Forestry and Biodiversity Office at the Bureau for Economic Growth, Agriculture, and Trade. But over the last year or two, the agency went through a major reorganization. And so this is now the current structure. We have central bureaus, regional bureaus, and pillar bureaus. The central bureaus tend to stay the same. The regional bureaus, that makes sense. It's the regions that we focus on. And then the pillar bureaus, which sort of mirror different sectors of development. So there's the Resilience and Food Security Bureau, Humanitarian Assistance, Conflict Prevention and Stabilization, Development, Democracy and Innovation, and Global Health. And then, as I mentioned, we have our field offices overseas. So where does biodiversity currently sit? It sits in the Center for Environment, Energy, and Infrastructure within the Bureau for Development, Democracy, and Innovation. So each pillar bureau has its own funding stream and associated strategies, priorities, and indicators. For example, the HIV program within the Global Health Bureau has funding dedicated to that technical area. And it has its own indicators. And an example of an indicator would be like number of people receiving antiretroviral medications. So you might have heard people say that USAID siloed. Um, and this makes integrated programming a little more challenging since each sector has its own funding and funding with associated priorities and indicators that they have to report on. So now let's talk about biodiversity conservation programming at the agency. It started in the 1980s. As I mentioned, the Biodiversity Division within the Bureau for Development, Democracy, and Innovation is the lead right now within the agency. And in 2014, USAID issued its first biodiversity policy, which had two agency-wide goals. The first is to conserve biodiversity in priority places, and the second is to integrate biodiversity as an essential element of human development. And we'll talk about that, what that means a little bit later in the presentation. The biodiversity policy also provides criteria for high priority countries, which we refer to as tier 1. And these are countries you would expect to be tier 1, such as Brazil, Indonesia, Colombia, Peru, Madagascar, and the Philippines. And the next slide clarifies that. So what's our funding look like? In our last fiscal year, USAID invested about $290 million in about 50 countries. The dark blue countries are the tier 1. And about 60% of the annual funds support the 12 highest priority countries and regions as identified by the policy. About 60 million a year goes to combating wildlife crime and about 180 million to conserve forests. So what does that programming look like? These are examples, some of the better known programs. So for example, in the early 1990s, USAID partnered with the Namibian government and WWF to help create community level conservancies, which from my understanding are still going strong and are considered a success story. In Nepal, USAID supported local community forest user groups throughout the Civil War that provided economic and governance benefits at a sort of unstable time. In Vietnam, USAID helped establish and implement a payment for forest environmental services pilot program, the first of its kind in that region. And USAID also has supported the Global Fish Alliance, which activities include the Spiny Lobster Initiative. And I think a common thread among USAID's support, they really support innovative and new approaches. So I'll give everyone a few seconds to read about why should we integrate biodiversity conservation at USAID. So I would say conservation is development is a guiding principle of USAID's biodiversity conservation integration. Essentially, the ecosystem services provided by healthy natural systems are a foundation for development, but it's also a two-way street with development efforts impacting biodiversity and sometimes negatively. So the biodiversity policy describes three pathways for integration. The first is pretty familiar to most of us, and I'm not going to go into detail on that. The second refers to biodiversity activities that can benefit other sectors. So this is the activity itself is benefiting the other sector. It's not necessarily ecosystem services. So for example, earlier I had mentioned that USAID supported community forest user groups in Nepal. These efforts also had governance co-benefits, including increased transparency in decision-making, decreased corruption, and increased equity of benefits sharing. The third pathway refers to working with other sectors to mitigate their negative impacts on biodiversity. For example, in some African countries, people are using malaria bed nets for fishing, which is damaging to freshwater ecosystems because the bed nets capture younger fish and release pesticides. So this pathway describes working with those sectors to mitigate these negative impacts on biodiversity. So as I mentioned, USAID loves its acronyms, and let's talk about our first activity, BRIDGE, which actually stands for Biodiversity Results and Integrated Development Gains Enhanced. So it's a mouthful. And it it's implemented by DAI and 4 subcontractors: Smithsonian, Conservation International, Relief International, and TRG, which is a communications firm. As I mentioned, the USAID biodiversity policy came out in 2014. So in 2015, Bridge was launched, and it was launched to help support goal 2 of the biodiversity policy through the development of tools and evidence, which I will talk about in the next few slides. And the 5 integration sectors that we focused on were climate change, democracy and governance, economic growth, food security, and global health. So to some extent, the sectors we focused on mirror the pillar bureaus of the agency. So these are some examples of Bridge products that we consider as tools for integration. They're all different reports. They can be found on our website. The first I want to highlight was integrating ecosystem values into cost-benefit analysis. So this one supports integration with the economic growth sector. The second one, thinking and working politically and strengthening political economy analysis. Supports integration with the democracy and governance sector. And then the last 2 products can be used for integration with different sectors. Moving on to evidence, some of our evidence products. So I was a lead for research and evidence on the Bridge activities, so I led the development of all of these products. So the first and the last of these products that I'm highlighting here, the one on wild fisheries and African development, and the one on the role of wild pollinators for food security and nutrition, support integration with the food security sector. The second set of products, the ecosystem-based adaptation evidence summaries and case studies, supported integration with the climate change sector. And then the bullet in blue, it was a research initiative on linkages between natural ecosystems and human well-being, which is what I'm going to talk about for the next few slides, supports integration with both global health and food security. So let me step back for a second. USAID's research on the linkages between natural ecosystems and human well-being dates back over a decade to when I started my AAAS fellowship with the Forestry and Biodiversity Office. I was actually interested in these issues. And at that time, I secured funding for and initiated a research activity that combined demographic and health surveys with environmental data. I had learned about DHS during public health school. And we were able to find a collaborator in Kirsten Johnson, who at that time was with a firm called ICF International. And ICF just also happened to be the firm that led implementation of demographic and health surveys all over the world. And these surveys are considered the gold standard for household surveys in low and middle income countries. So we collaborated with Kirsten and we conducted 2 pilot studies, one terrestrial and one marine. And what made this type of analysis possible was that the DHS data is geo-referenced, as was the environmental data, so we could look at these spatial relationships. So in Malawi, we found that proximity to tree cover was associated with improved child nutrition outcomes and decreased risk of diarrheal disease among children. And in the Philippines, we found that proximity to marine protected areas was associated with improved child nutrition outcomes. So we were able to get both of these studies published. And since then, a number of studies have used and built upon this methodology to look at environment and human well-being linkages. And so you'll see some familiar names here. The GUND has been a leader in expanding upon this approach. So in 2016, Taylor shared the study that I've highlighted in blue. This was Diego Herrera's study involving 30 children. I think it was over 100,000 children maybe in 35 developing countries. And I immediately sort of recognized that this is relevant to USAID's work. So I shared it with USAID colleagues. I was on Bridge at that time. And Diego, in fact, was asked to come and present his findings to agency colleagues because they found it very interesting. And it was about that time that Bridge and USAID learned about this database that the GUND had been putting together that includes DHS from multiple countries and environmental data from different sources. So USAID, through Bridge, partnered with the GUND to continue this work, which is how I've had the chance to work with Brendan Taylor and Renivo over the last several years. So through the partnership, we wanted to address two key research questions. Number one, what's the role of forests in securing dietary diversity? And do forests moderate the effectiveness of water treatment technologies designed to reduce the prevalence of diarrheal disease in children? So why are we focusing on dietary diversity in this study? So I think I had mentioned that each sector of development has its own priorities and its own indicators. And dietary diversity is one of the top 2 or 3 indicators for our food security colleagues. Child stunting is another one. So this study and its outcome is very relevant to our food security colleagues. And so Diego found that exposure to forests leads to 25% greater dietary diversity for children, and exposure to forests leads to increased consumption of vitamin A or iron-rich foods. And in low-income countries, many, many children are deficient in iron and vitamin A. So, and these results could be comparable with some nutrition interventions. So this is a major study that we shared widely with our food security colleagues. In the second study, we looked at diarrheal disease, which is one of the leading causes of child mortality in low-income countries. And in fact, USAID and other donors invest hundreds of millions of dollars each year in community-based interventions, such as taps, toilets, and point-of-use water disinfection. So this study was a little bit smaller. We had data from 6 countries, and we looked at 2 water and sanitation, what we call WASH interventions, which was a piped water source and point-of-use water chlorination. And so what we found is that low and high upstream tree coverage, the 2 drinking water improvements did not have significant effects. And we theorized that with low forests, the water quality is quite poor. The water tends to be highly turbid, and the turbidity can clog filters and other downstream gear. And it also allows pathogens to hide from disinfectants like chlorine. With high forests, we're theorizing that the water is high enough quality that the downstream efforts don't actually make much of a big contribution. So we're not saying in any way that forests could replace downstream interventions, only that they can affect that forests may affect the effectiveness of these interventions. And I just want to highlight that I think when we were sort of thinking about this study, as far as I know, not a lot of other studies have looked at how does ecosystem degradation impact the effectiveness of development strategies or interventions. And considering the billions of dollars that are being spent on development programming and how widespread ecosystem degradation is, I think that this is sort of a new frontier in research and very, very relevant, not just to USAID, but to donors everywhere. So towards the end of Bridge, we also published a paper with USAID colleagues on how to operationalize this growing body of evidence in food security and global health programming. And this was truly a collaborative effort with USAID. And I'm not sure that something like this could have been done 10 years ago. I think that the evidence and the collaboration around the evidence has really fostered relationships between biodiversity, global health, and food security. So if you look at the co-authors on this study, the second one is Kirsten Johnson, who I've mentioned has been a long-term collaborator, initially with ICF International, and now she's with the Bureau for Food Security at USAID. Rob Cohen is a physician with the Bureau for Global Health, and Sarah Carlson works with the Biodiversity Division at USAID. So we wanted to publish this in a global health journal, so we were able to get it into the bulletin of the WHO. And so what we wanted to address was if there are food security and global health programs out there that are ready to start incorporating ecosystem considerations, how would they do it? What are some initial steps? So we came up with 3 suggestions. The first is to incorporate ecosystem related questions into baseline surveys. So most food security and global health programs, the first thing they'll do is to do baseline surveys to understand more about the community that they work in. And so we suggest starting to add some questions on ecosystems. For example, if the program is focused on a coastal community, add questions about how long are you is it taking you to fish the same amount of fish? Are the fish smaller? Are you having to go out for longer periods of time? And then if they find that the questions suggest that ecosystem degradation is starting to impact the community, um, then we suggest going to the second step, which is that food security and global health programs can start to support efforts to improve ecosystem management. And we're not saying that they would do it directly. We're suggesting that they can fund sort of local environmental organizations to do this kind of work, since these global health and food security programs likely won't have the capacity. And then the third bullet relates to, our third suggestion relates to the third um, pathway of the biodiversity policy, which is to minimize potential negative impacts of global health and food security programming and maximize environmentally friendly practices. So, for example, if the global health program is focused on malaria prevention and they're passing out bed nets, it's on them to really understand how people are using those bed nets. And if they're using them for fishing, then put some mitigation measures in place. And then in terms of environmentally friendly practices, we mentioned like agroforestry, sustainable fisheries management as practices that these programs can support. So overall, how did Bridge approach integration at the agency, especially given how large it is, how somewhat siloed it is? So these are some approaches that we were able to apply sort of broadly. We often conducted focus group interviews with target sector staff to help shape evidence products. For example, as you recall, one of our evidence products was a report on the importance of wild fisheries to African development. So before we started developing that report, we met with food security and nutrition colleagues at USAID, learned about their perceptions of fisheries, and then incorporated those lessons into the report. Bridge also reviewed key target sector resources such as fact sheets, strategic plans, indicators, and guidance documents so that we could learn about those sector priorities and then learn about their terminology so we could incorporate that into our evidence products to make them more relevant. As biodiversity has its own language, so does every other development sector. We also, whenever possible, co-produced evidence products and outreach material with target sectors. So for example, with that fisheries report, again, I would share interim interim drafts with food security colleagues and ask for their feedback. And then within each sector, we identified sector champions and engaged with them through each step of evidence production and dissemination. So in the prior slide, that paper for the bulletin of the WHO, Kirsten Johnson and Rob Cohen were co-authors, one from food security and one from global health, and they were champions as well within their sectors. So what do we learn overall? It's really important to understand the type of evidence that motivates each sector. And that's our way to produce actionable, relevant products. And as an example, the global health and food security sectors really look at peer-reviewed literature and peer-reviewed studies. That's often how it really influences their programming. So it was really important that Diego was able to publish his paper on dietary diversity, and I'm hoping that the second paper also gets published. Having regularly scheduled meetings with target sectors fostered strong collaboration. So I refer to integration working groups here. So when the biodiversity policy was launched in 2014, the biodiversity team at USAID started to form these integration working groups with different sectors. And basically they are colleagues from each sector that are interested in sort of common programmatic interests, priorities, et cetera. And they would meet regularly, like once a month or every 6 weeks. And so when Bridge started in 2015, we were able to tap into that. And these integration working groups would review some of our products, review our ideas for our new ideas, give us feedback. So it's very helpful to have that regular exchange. Then we know that developing evidence products is not enough. Translating evidence into action requires effective communication and knowledge management plans. So we worked closely with communication staff. I mentioned human-centered design here, which is a framework for producing evidence products based on a good knowledge of the audience that you're trying to reach and making it relevant for that audience. And lastly, research collaborations can help USAID's implementing partners conduct more policy and practice and policy relevant research that supports cross-sectoral programming. So even in our collaboration with the GUND, I had a lot of conversations with Renivo and Brendan and Taylor about what we were looking for, what would influence programming at the agency. So towards the end of Bridge, the agency launched the Environment and Natural Resource Management, INRM framework, to coordinate, unify, and elevate environmental, climate change, and natural resource management work across the agency. It has two priority areas: improving natural resource management for self-reliance and improving urban systems for a cleaner environment and enhanced human well-being. 9 focal areas, including sustainable food systems, One Health, water resources management, and land and resource rights. And all of this information is available on our website. So just as Bridge helped implement Goal 2 of the biodiversity policy, the Integrated Natural Resource Management Activity, INRM, was launched in 2020 to help implement the USAID's Environment and Natural Resource Framework, so the ENRM. Also implemented by DAI and this big consortium of partners. I've been working on INRM as the Food Security and Global Health Liaison for about 7 months. INRM, as I mentioned, supports the uptake of principles and approaches outlined in the agency's ENRM framework. And it's funded not just by biodiversity, but also by divisions of land and resource governance and the Forestry and Sustainable Landscapes Division. And lastly, I'm going to close with the Hearth activity, which I'm peripherally involved in, but is a very exciting new initiative. Hearth stands for Health, Ecosystems, and Agriculture for Resilient, Thriving Societies, another acronym. Launched in December of 2019. It's been a little bit slow in implementation because of COVID. It's a call for public-private partnerships with a stated goal to conserve high biodiversity landscapes and improve the well-being and prosperity of communities that depend on these landscapes. So currently there are 15 activities across 10 countries representing 140 million in public and private investment. And each activity integrates biodiversity conservation, food security, and global health. And I wanted to close with this because I think that this is an example of the type of USAID on-the-ground activity that can be catalyzed by this growing body of evidence on biodiversity and human well-being linkages. So with that, I will close, and I look forward to your questions. Thank you.
Thank you, Anila. Thank you for your time and for being here. If we were at the GON, everybody would be applauding, but now we have virtual applause. So everybody, if you have questions, you can put them in the Q&A box, comments or questions for Anila. Most of your talk, I appreciate the intersectionality of incorporating different people, teams, perspective, and that's something we talk about in the GON, the importance of and transdisciplinary in doing applied work, but that is also theoretically grounded. In those lines, I'm going to ask you a very general question. How do you, as a physician, how does that training inform the work that you do? How do you bring that to the table? And how do you leverage that? Because to me it's very common to me in those spaces to see people with PhDs or engineers or more technical. So I'm curious about your experience as a physician doing that type of work.
Yeah, I think that's a great question. Thank you. I think that, so I mentioned that research project we started almost 10 years ago using demographic and health surveys. The only reason I knew about those is because I went to public health school. When I presented the DHS to my team and the biodiversity team when I first started as a fellow, nobody had heard of it. So I think that it's really important to have people from different backgrounds come in. I still see patients on a regular basis. So the medical community is evolving in the way that they use evidence. And I'm trying to bring some of that experience into USAID as well. So I think also it helps me understand who we're working for, right? I'm working for patients. And so much of this environmental work is to improve the lives of these communities as well. So. Yeah, and in terms of sort of my personal journey, I was trained in a very classic way. I was pre-med, went to went to medical school, went to finish my residency. I hadn't done any environmental studies coursework at all during any of that. And then once I finished residency and started to work, I had a little bit more time and I started to read about environmental issues, which I actually had no exposure before that. And once I read about climate change and biodiversity loss and deforestation, I quickly realized like that's going to be the major determinant of what human health looks like in the decades to come. So that was sort of my thinking too as I made the transition to environmental work.
Taylor has a question. He asks about if you could please talk about how researchers at universities can partner with you and USAID to support that work, and how does it work best, and how might grad students get involved?
Good questions, Taylor. I don't confess to be a USAID expert. As I mentioned, of my time there, I've spent 2 years inside the agency as a AAAS fellow, and then the rest of my time has been on the implementing partner side. I mentioned it's very hard for you to go to USAID and say, I have this idea, because most USAID activities are planned well in advance. There's a procurement process. When I mentioned that a request for proposals has to go out, it's a very formal process. So, and that's, to address any issues of corruption or anything like that. So I would say that, and this is something I don't have a lot of experience with, but I think that approaching a mission in a country is probably easier. They tend to be smaller, a little less bureaucracy. And they might have a little, especially because if it's country relevant research that is relevant to some of the mission's priority programming, it's probably easier to address them or to look at, because each mission, not only does USAID headquarters put out requests for proposals, but each mission is constantly putting out new requests for proposals for their own programming as well. So I would say that that's probably an easier path to sort of tap into USAID. Again, no guarantees, but USAID Washington DC is just not set up. I think that sort of everything came right for Bridge to collaborate with the GUND as we have done in the last few years. And I'm sorry, Taylor, I don't. It's not as specific probably as you would like, but it's just how it is. Wait, can I add something too? There is,
Yes.
I think, an interest within the agency, or at least with missions, to support local universities and build capacity at the country level. So that's another way for graduate students, if they have an affiliation with a university in a particular country, that's another route.
In that line of doing the partnerships or reaching out to USAID or the different types of collaborations that are done, you talked about the importance of those collaborations and the positive results that come from that. Can you talk a little about the obstacles that you have faced, or the obstacles that these projects that you talked about face? What things don't allow them to work well, or how you expect it?
You mean in terms of the research partnership itself? Or the,
Yeah.
Well, my experience with the GUND, we were able to, once that interest was in place and USAID was interested, we had the mechanism or the activity, so we were able to go through Bridge pretty quickly, get the research started. I think timing with an agency like USAID is always an issue, because anything we put out has to go through multiple levels of clearance. And I've gone back and forth with Taylor because I've apologized, like this is our process. So, there's timing, and I think that it's just finding the right activity or mechanism that you can use to then partner. And we just got lucky with Bridge being able to put that collaboration together with the GUND. And honestly, one of the reasons that we were able to do the partnership with the GUND so easily is because they had a unique product that nobody else had, which was the database. So we were able to say that we wanted to work specifically with the GUND because they had a specific product that nobody else had that we wanted for our research. So.
Thank you. And I think in line with that question about obstacles or external barriers, Bailey Roland asked, how much does the presidential administration affect the priorities and budget of USAID? And if you see major priority shifts when the administration changes?
We do. So interestingly, and not super well versed with the political side of it, but we had relative stability with Mark Green. Mark Green was the administrator under the Trump administration. So really the Environment and Natural Resource Framework, the INRM, came out during the Trump administration, and that was under, I believe, the guidance of Mark Green. He left in about a year ago. And the agency was going through some changes, but now with the new administration in place, they've only been in place for a few months. We haven't seen major changes yet. But our new administrator, Samantha Power, was just confirmed, and she's got a long line of, she's got a diplomatic background. So very hopeful. Interesting thing about biodiversity funding, I would add, is that it tends to have support from both parties. So, it started in the early 80s, as I mentioned, and funding tends to go up a little bit every year. So far, I like to say that, that sort of funding seems to be resilient because there's support from both parties. But we're waiting to see what the new administration means.
Yeah. So if one works at that agency or any other particular agency, there has to be some flexibility in managing those shifts and changes.
Oh, for
there's
sure.
Another question. Mm-hmm. Another question. With so many projects in so many different countries, how does USAID ensure that their activities always include local actors' interests, realities, and cultures to avoid colonialism or imperialistic conservation recommendations and improve the applicability of the efforts of the agency?
I think that's a fair question. And I don't have a biodiversity background, so but I know that the sector is moving towards engaging communities more and more, local communities. I would say of the examples that I showed, the Namibian example and Nepal, they're all community-based natural resource management seems to be the way that USAID is doing its biodiversity work. Again, I can't speak to what it's been like in the past, but in my experience, engaging local communities is front and center for all of the biodiversity work. And definitely for food security and global health. And there's a huge emphasis on local building capacity locally, whether it's universities or nonprofit organizations. There's really, I think the agency is definitely moving to engaging local communities in every way possible. And also women and other disadvantaged groups. There's a huge push for that to make sure that groups that have typically been underrepresented are front and center in terms of decision making. As I mentioned, we have all these indicators we have to meet, and many of those indicators relate to gender. So if you're doing a training, how many women are in that training? Empowering women to make decisions and become decision makers in their communities. So I think we're aware of what's happened in the past, and I think there's real efforts to make sure it doesn't happen again.
Yeah, and I think it's similar to academia and research to do more participatory work where those local communities have a say in how the projects are carried or the direction. So to not have that extraction
For sure.
part.
It's a work in progress though, right?
Yeah, for sure. Jolanda Shen has a question. She asks, it sounds like the USAID initiatives are aiming to be much more integrative. How does USAID plan to take what sounds like a very siloed bureaucracy to enhance interdisciplinary collaboration?
Yeah, I think the Hearth example is a good direction for us. So the way that Hearth works is that they were able to bring funding from these three sectors. But because Hearth as a component of improving health, the health folks are able to invest their money. Improving biodiversity, the biodiversity folks are able to bring their money. Improving food security. So each of these focal interests, they're able, each of these sectors, their focal interests are able to be met. And so the thing with Hearth is that you can't do that kind of programming in all geographies, right? It has to be a high biodiversity area. Otherwise the biodiversity folks don't want to work there. So it's difficult, but I think Hearth shows that it can be done, and it shows that there's a lot of interest in it. As I mentioned, I think, let me see if I can pull up that last slide again. I mean, look, $140 million, considering most USAID biodiversity activities are maybe $10, $20 million over 5 years. This is a lot of money in a pretty short period of time. So what it shows is that especially the private sector is very interested in these integrated approaches. At the launch of this event, the private sector partner that came to help launch it was McCormick. They do spices all over the world, and they're really interested in having a sustainable natural resource base so they can continue to produce their spices. So I think it's looking for sort of win-win, knowing that integration isn't going to work everywhere, frankly. And we have to realize that like integration isn't the answer to everything. It's very deliberate. We have to work within each sector's sort of framework. Like they have their, like I said, health wouldn't be interested in this unless we talked about improving the health of those local communities. So there's no hard and fast rules for it. Like every situation I think has to be assessed. And is this the right place for integration? And what is each sector going to get from it?
And talking about Hearth, Taylor Ricketts has another question. For the Hearth initiative underway, he asks, if you could wave a wand and make any research possible or happen that support that initiative, what would it be? And what do you think are the knowledge gaps? The knowledge gaps are that will be most useful to fill.
Yeah, I mentioned this a little bit, I think in the second research question that we addressed through the GUND. I think the next frontier is going to be understanding how ecosystem degradation is impacting development, strategies, interventions, etc. For example, malaria is a huge area of investment for not just USAID, the Gates Foundation, all these folks. Do we know how deforestation in certain areas is going to affect malaria treatment or malaria strategies in a particular geography? As far as I know, they're not even thinking about what the forest cover situation is in their settings. Similarly, as you know, we're spending hundreds of millions of dollars in the WASH programming, toilets, taps, and all of this. And most WASH investors are not thinking about the forest cover, like what's going on around them, where's the water coming from, and what does that water look like? And so I think helping the global development community understand that ecosystem degradation is really a threat to their success. Their current programming, but could we also reverse some of the gains that have been made? You know, if you're a nutrition program working in a community and you're passing out vitamin A supplements or whatever it is that you're focusing on, and yet the fishery in that community is getting degraded every year, and fish is the major source of protein and micronutrients, well, one gain with your programming could be offset by a loss from the fisheries degradation. So I think that that is the new frontier, is thinking about that relationship.
Great. Now I have a very selfish question. I, as some students at the GUM, very interested in science policy or doing work in spaces that are non-academic, and you talked about that you were a AAAS STP fellow. So could you talk a little bit about that experience and how that experience served you for the work that you're doing right now?
Yes, and you or any graduate student, you have my contact information. I'm happy to talk one-on-one about this too. But I will be honest, when I started to get interested in environmental issues, given my background, there weren't a lot of organizations that had a job description that I could even apply to. And so the AAAS fellowship allowed me to move into the conservation sector in a way that I think may not have been possible otherwise. So it is, and I've heard, not just for myself, but I've heard a lot of other fellows describe it as life-changing. So, for those that don't know what the fellowship program is about, it brings scientists into government agencies. Most of my colleagues were PhDs. I was one of like a handful of MDs. Um, and it's thriving in DC, and you're going to be you have choice in what agency you'd like to go to. When I applied, there were 3 different tracks. Like if you're interested in health, you went to more like the NIH track. I did the development tracks, which is how I ended up interviewing at USAID. And I'll be honest with you, I back at the time when I was applying, I don't know how that's changed. It's been a decade now, but it was kind of like a matching program. Like the agencies that were interested would get a list of fellows, and then the fellows would get a list of opening positions. And so the fellows were invited to reach out to whichever offices they were interested in. At the same time, offices would reach out to fellows to schedule interviews. So given my background, I got a lot of interest from the health agencies, which isn't really what I wanted to do. I wanted to do environment and conservation. So I actually reached out to the Forestry and Biodiversity Office. I saw that they had a position open, and I said, I know I'm not your typical candidate, but I'm really interested in making the linkages between biodiversity and health. And I got an interview, and I think that during the interview, I was really able to talk about how passionate I was, and I ended up getting that position. And I was the first, I think, MD ever on their team, but also I think in that whole bureau, which was economic growth, agriculture, and trade. Like it's not a typical place for someone with my background to end up, but it worked out. So I would say to other people applying for the fellowship, have some gumption and go for what you want, and it might work out. And like I said, I'm happy to talk to anyone about the fellowship. I think it was such a great opportunity.
Yeah, thank you. Thank you for sharing about your experience. I've heard great things of people that have gone through that fellowship and the works that they are doing.
And I'm not unique
currently.
in continuing that work. Many of my colleagues that were AAAS fellows have stayed with USAID. I didn't stay with them, but I ended up on the implementing partner side. So still working on USAID programming. Yeah.
Mm-hmm. So there are 10 minutes. We still have 10 minutes for questions or comments. So if you still have a question or comment for Anila, you can put it in the Q&A box. I would like to talk a little bit about food security in a more disaster context. So can you talk about, given climate change, can you talk about how your works look at emergency management in those places in relation to food?
Yeah, I didn't. So the Office of Foreign Disaster Assistance, OFDA, is the division within USAID that deals with humanitarian assistance. But I can tell you that one of the products I worked on with Bridge was on ecosystem-based adaptation or nature-based approaches for climate adaptation. And we did a whole report on food security, how restoring degraded ecosystems or conserving ecosystems is absolutely crucial to meeting food security goals and helping make communities more resilient in terms of food, in terms of food security. So some of the examples we mentioned is really strengthening fisheries management, because we know that with crop failure, people will turn to fishing sometimes. Applying practices like agroforestry, to increase the resilience of these systems. So if you're interested, I can share that information, but also I can tell you that the agency, especially with the new administration, is very focused on resilience, food, just resilience overall, water security, food security, and all the aspects of resilience.
Thank you. We have another question from Tafese Stefanos, and I apologize if I didn't pronounce your name correctly. They are thanking you for your presentation, and they ask, on the project about the link between environment and human well-being, how did you select those countries that USAID has been actively working on conservation and human well-being issues? Is it driven by environmental and climate changes, or strong partnerships or local actors in those countries? They say, I think in sub-Saharan countries, some included in USAID projects, the link between nature and human livelihoods and human health is critical.
Mm-hmm. So I'm not sure which, there's been many steps in our human well-being and environment research. The first set, like I mentioned back when I was a fellow, we did those 2 countries because we had good demographic and health survey data, the Philippines and Malawi. So it was opportunistic, honestly, at that point. And then a lot of the GUND research, again, that has been so important, has been based on where the DHS is available and where the good environmental data sets are available. So I'd like to say that it was a very deliberate process with, looking at the situation in each country, but it wasn't. It's based on what's available in terms of data. Now, going to HEARTH, which is on the ground programming, I would say that probably, because I'm not intimately involved with the activity, but I would say that because it's a public-private partnership, it's where the private partners want to work, or where they're already working and they think that an integrated approach would be helpful. So I think the person asking the question was hoping that I could give an answer that we're really thinking about each country's vulnerabilities, and I think it's more opportunistic right now than that. But it's a good start. We have to start somewhere.
Yeah, thank you. So we have 5 minutes left. So if anyone has one last comment or question, they can put it in the chat. So I got a little confused. So USAID does not collect data in terms of research. Do you do primary data, or it's with partnerships and available data that those countries
partnerships. So if you consider the DHS, the Demographic and Health Surveys, a form of data collection, it's not a USAID employee that's out there. They're always going through an implementing partner. And for many years, that implementing partner has been ICF International. What happens is that implementing partners tend to build up a skill set, so that every time a new RFP comes up the Demographic and Health Surveys are every 5 years, there's a new proposal for them that USAID puts out, because you don't want the same firm doing it over and over and over. You want to see what else is out there. But as DAI was successful in getting the Bridge project and getting the INRM project, because they build up the skill sets to be able to respond to these requests for proposals, ICF International has been successful every 5 years in getting the DHS project. So yeah, I would say very little data collection would probably happen with USAID staff members. Even admissions, they're partnering with local universities and local NGOs to do that research on the ground.
Great. So to end, at the beginning, I asked you how your training and your experience as an MD informs the work that you do, and how do you brought that into the agency. So I'm curious about how the work that you have done in the agency and those experiences at that side have informed your medical practices, and how you bring that to medical communities or other doctors that may not have the opportunity to have those experiences that you have, or focus on social determinants of health and all that.
I would say that my physician colleagues are still, their focus is on one patient at a time. I do hospital-based internal medicine, so we're hospital patients, and the last year has been COVID. It's hard. Like, I think it's still hard for them to understand. They see a healthy, beautiful world out there. I think it's hard for a lot of them to understand the crisis that I think we're in terms of our global environment. I try, but the focus is still on our patient care. But I do know that organizations like the American Medical Association, the AMA, which is one of the largest organizations representing physicians, is starting to recognize climate change, starting to feature it in some of their publications. I think they probably put out some sort of a policy statement on it or something. Biodiversity loss, unfortunately, is not even on anyone's radar. I don't know how we do that, but at least climate change is starting to be a little bit more high profile. But I will say that the medical community, at least in the US, just has other issues they're focused on. Obviously COVID over the last year, but reform of our medical system, like this is very low on their list of things that they think about, unfortunately. So I do a little bit of sort of diplomacy when I'm there and I talk about what I do, but not a lot of traction sometimes.
Yeah, like you said, it's a slow, ongoing work, and I think we're seeing some change, but it's gradual.
Yeah.
Well, now to end, a person asked, how has COVID-19 in general impact these activities, and I guess USAID activities, and did the purposes of the activities change because of the pandemic?
Yeah, good question. And I would say that almost every mission out there has changed some of their programming, whether it's their environmental programming, um, or obviously the global health and food security sectors are all have moved very quickly. This is what USAID, I mean, they're humanitarian assistance. They're able to rapidly mobilize, put funding towards this. So one small example, there's a program that I have been looking at in Ghana. It's a USAID program on wild fisheries. Because Ghana's marine fisheries are so critical to their well-being and their food security. And very quickly that activity was able to incorporate a COVID element where they started to work with fishers and fishing communities, trying to get COVID under control in those communities and put some other measures in place. So I would say that it has entirely changed what the agency is focused on over the last year. But this is what we're set up for. When we're set up to move very rapidly and get resources out there. And I'm happy to say I think USAID is probably making a big difference on the ground.
Yeah, similar to what you said about the question around presidential changes, that the agency has to be flexible and aware that those changes out of their control happens.
Yep.
So thank you, Anila,
for
your presentation. It's been great. So I think this underscores the importance of intersectionality and also bringing different voices to the table. So a big thank you from the Ghana Institute of the Environment, and we hope to have you in the future, maybe live instead of virtual. So thank you. Have a nice day, everybody. Thank you for attending.